A new study reveals that not exercising is deadlier for your health than smoking, diabetes and heart disease. The findings were based on the retrospective study of 122,007 patients who went through testing at Ohio's Cleveland Clinic over the course of 23 years, between 1991 and 2014. The results were published Friday in the journal JAMA Network Open. Being unfit on a treadmill or in an exercise stress test has a worse prognosis, as far as death, than being hypertensive, being diabetic or being a current smoker, Cleveland Clinic cardiologist and senior study author Drive. While Jaber told CNN, "The findings," he said, "were by far the most pronounced and objective ever seen, and were extremely surprising." Jaber noted that, while the dangers of leading a sedentary lifestyle and being out of shape are well known, he admitted that he was surprised by the study's findings, which indicate that both states overwhelm even the risk factors as strong as smoking, diabetes or even end-stage disease. Breaking down the results, researchers found that people with sedentary lifestyles had 500% higher risk associated with death than those categorized as being top exercise performers. Those that exercised minimally still had a 390% higher risk associated with death compared to those that regularly exercised. Meanwhile, those that didn't do well on the treadmill test were said to have almost 2 times the health risks as those with kidney failure on dialysis. Share this article. Share as such, Jaber said, "There actually is no ceiling for the benefit of exercise, including in the case of ultra-exercisers, who are sometimes said to be at higher risk of death due to the extremes they push their bodies. We can see from the study that the ultra-fit still have lower mortality," Jaber said, indicting that there is no amount of exercising that could result in health risks. While the study found that exercise benefits were seen in both men and women of all ages, the benefits might be a little more pronounced amongst women, Jaber said. Either way, he said that lack of physical fitness should be considered as being on par with hypertension, diabetes and smoking when it comes to health risk factors. As such, being unfit should be treated almost as a disease that has a prescription, which is called exercise, he said. Hospital for Special Surgery sports medicine physician Dr. Jordan Metzl, who has also written the book, The Exercise Cure, noted that $200 billion is spent a year treating cardiovascular disease and diabetes and their complications, making it the most expensive diseases in the United States. Rather than pay huge sums for disease treatment, we should be encouraging our patients and communities to be active and exercise daily, Metzl told CNN, advising that once cleared by their physicians, patients shouldn't be afraid of exercise intensity.